Good evening, everyone. I'm Dr. Basil Considine. I am here from the ACU Online Writing Center, and today we're going to talk about writing as a nurse, writing policy analyses. Now, this is a targeted webinar in our series, and because we are well into the semester, I'm just going to gloss over the normal introductory information for the Writing Center. We work with students in pretty much every online program at ACU, and we are happy to work with you at any stage in your writing process. You can schedule an appointment with us by signing up through our online system for an asynchronous appointment, meaning you upload your paper, and by the time your appointment rolls around, we will look at it and within 24 hours send you some feedback. You can also request a real-time appointment via phone or Zoom by sending an email to onlinewritingcenter@acu.edu. Do send us a range of potential times so that we have a better ability to match up with what you are looking for, what you want. Also on this, we have many other resources, including recordings of webinars such as this that you can watch at any time, as well as sample papers, templates, and other resources available on the Online Writing Center website. We have a number of webinars coming up in the rest of the term, including right after this, we have a webinar for the EDD program, Interviewers and Adopter categories. And if you can't make one of our webinars, but you're still interested, just go ahead and RSVP for it anyway, and we'll automatically send you a copy of the recording and the slide deck afterwards. This is a small selection of the webinars that we have recordings available of. You're more than welcome to view these at any time, and if you see a tie-in with the course that you're in, by all means, dial it up, take a peek. All right, we have three main things that we're going to be focusing on today. First of all, we are going to be looking at the policy analysis paper genre. This is a particular sort of paper that has both professional and public-facing applications, in addition to the assignment that we'll be looking at today. Now, we will also be looking at the specific Week 4 assignment for Nursing 721. This is the Political Analysis and Strategies paper. We'll be discussing the requirements, we'll be discussing the grading, we'll discuss how this fits within the larger genre, and we'll also be working on modeling the outlining and drafting process, how you go from the instructions to planning the paper and then ultimately writing it. All right, let us dive in and discuss the policy analysis paper genre. Now, policy analysis papers, these are used to identify and evaluate the advantages and disadvantages of specific policies and to take that as a basis for suggesting and analyzing alternative options. A policy analysis paper is normally looking at something that is already going on and saying, here's what our options are, here's the pros and cons, here's what we should do. Now, it's usually, but not always, analyzing government policies. Now, in the healthcare context, this is, of course, something where the United States has a mix of public and private systems through private health insurance, through public systems such as Medicare, Medicaid, and so there may be things where it is overlapping or getting both. If you're doing your research in another country, there may be one system, there may be multiple. In Canada, for example, there are different systems in each province. If we're going to the UK, there is the National Health Service, but there's also a private system of healthcare that has grown up in parallel with that. So while you will usually be analyzing government policies if it's something to do with healthcare, it is possible that you are dealing with something that operates outside or in cooperation with that framework. Now, policy analysis papers are often targeted at specific groups of stakeholders. This is in part because you are trying to inform them about what the options are and to suggest the best course of action. And this is usually being written about policies that have complex issues where there's not a quick or simple answer, where you can't just say, oh, we should do this, all the benefits say to do this, open check case, good, let's go home. You probably don't need to write a complete policy analysis paper if it's that open and shut. Now, some things to keep in mind. You should be providing clear and specific recommendations for policymakers. A policy analysis paper is not intended as just an idle thought exercise. It is supposed to catalyze, to enable, to inform action. And these policymakers that you are writing for, whether they are people who will directly be drafting it, such as legislators, or people who will be participating as voters or lobbyists, etc., they are generally not an academic audience. There are exceptions. If you are lobbying, for example, the administrators at a university hospital, that might be a case where they are coming from the academic background and seeped in academia, and so the certain terminology would be very appropriate, depending on the exact case. Now, recommendations that you're going to give, they should be ideally anchored in strong, clear data with whatever analysis is necessary to make things clear. And you also don't want to be presenting hypotheses as conclusions. This is actually one of the very common pitfalls, to give a proposal and say, okay, well, it's clear as day. Well, hold on. Do you have information to back that up? Now, if you'd like to see some policy papers, especially those with contrasting views on a different matter, I've given you some links here. The last one is for the journal Policy, Politics, and Nursing Practice, which includes both analyses of policy papers and policy papers themselves being published, as well as a few related things. There are some students who will write a policy paper for an assignment, and then they will go and adapt it for the particular requirements of each journal to publish it, which is great. It's probably not a surprise if you're in the Doctor of Nursing Practice program that there are some things where the American Association of Nurse Practitioners and the American College of Physicians have opposing recommendations, particularly about the scope and practice of nurse practitioners, things like prescribing power, supervisory authority, and things like that. And so if you go to these websites, you can find opposing papers and see, oh, how do those arguments compare? Are they working with the same data? How do they reach the disparate conclusions that they do? And one of the reasons why you'd be writing a sample policy paper is that, why you'd be writing a policy paper on the job is that these are complex issues that do not have very open and shut answers, because we have these two well-respected professional authorities that have come to their different viewpoints, and their reasons why they have that, and different sets of pros and cons that they present, and you are trying to write the most convincing case that you have for the stakeholders that you are lobbying to reach their decision. Okay, with that preamble in mind, let us move into the political analysis and strategies assignment here. So this is for Nursing 721, the Week 4 assignment. And so this is for the Informatics to Improve Patient Outcomes course. And we are looking at this assignment where the instructions say, oh, continue with the same policy issue. I'm sorry, I left something out. This assignment, the Week 4 assignment, is linked closely to the same week's discussion, where building on previous work, you are advised to continue with the same policy issue you selected for your course policy project, describe the analysis framework that you use for this particular issue, and give a rationale for that framework. So with this in mind, that you are discussing this and you are less formally working around this issue of describing a policy issue and what you recommend should be done, we have the related follow-up assignment where you're being tasked with writing a analysis paper that's evaluating this healthcare policy issue, using the framework that you've identified in the discussion. So one of the common pitfalls with this assignment is to look at these in isolation and to come up with a completely separate framework. That's more work than you have to do. These should be related. You should be building on your earlier thought exploration in the discussion in the analysis paper that you're writing. Now, this assignment gives a specific list of things. You should be evaluating the issue through a process that includes summarizing the policy issue, that includes evaluating the effectiveness of the policy change and the likelihood of achieving the specific goals or objectives laid out, proposing efficiencies that this will bring. The change should have some benefits, efficiencies in cost, labor, etc. You should also be analyzing the equity of the policy. Is this fair? Is this just? Is it making it more fair somehow than the situation that currently exists? Is it going to be grabbing freedom or giving benefits that are commensurate to a reduction in that? This is true if you're doing things that have the potential to be interpreted as invasive or requiring access to confidential patient data. You can't just do it because you can. There needs to be a benefit to balance out and ideally reward this, shall we say, infringement on their liberties or freedoms. You also want to evaluate how the change is going to be impacting nursing and the healthcare system. Is it going to be a social responsible thing? Now, the rubric for this assignment is pretty straightforward. It is enumerating those things and assigning some points to it. And there are a couple things I want to draw attention to. One is that a relatively small portion of the points here, a 1/12 of the credit, goes towards summarizing the policy issue. So although that is certainly a part of this assignment, it is a smaller part of the credit, and so it should be a smaller part of your paper. A 1/12 of the credit, well, a 1/12 of 5 to 7 pages or so is roughly half a page or thereabouts. So a paragraph or two to give that succinct summary of the policy issue, and then most of the credit goes to how you follow up and develop it. So just keep that in mind as you're planning things out. Something to keep in mind, typos happen. Typos happen in syllabi, and in this case, if we were to look back at the written out instructions, we find a slight disagreement. The instructions say write a 5 to 8 page analysis paper, and then the rubric here says 5 to 7. Now, because 5 to 7 is encompassed in 5 to 8, I would go with that, but if you're spotting this, it's always a good idea to send an email to the instructor and say, hey, I noticed this. Can you give me some advice? And in this case, we'd find that, yes, there is a discrepancy there. And while you won't run into trouble if you run into 7, if you're really thinking, I'd like to do 8 pages, as that would save me from having to cut things down, well, just send that email out sooner rather than later. Now, another common pitfall with this assignment is to not look at this in connection to the other things for the course, because there is a related background module for this assignment that gives a list of things that you should be discussing, and make sure that you identify the issue, give the context for the issue, address the political feasibility of it, the stakeholders, to enumerate the stakeholders, to discuss the economics and related resources, give a values assessment, explore the networks and coalitions, describe, okay, where's the power in this situation and how might that be changing, and list the goals and proposed solutions for this. So this is partially overlapping with the earlier list that we were getting here, but you'll note that there are 6 items here in the rubric, but we have a total of 9 here. So the related module is actually giving you instructions on where you should be providing additional detail. All right, so we have reviewed the assignment and found that there are 3 interlocking components here. Just to recap, the first interlocking component for this assignment, we have the discussion assignment here, which is asking that you provide a framework that you're going to use for this assignment. And then in the assignment itself, we're going to be using that same framework that you chose for the discussion as part of your analysis here. So you don't have to recreate the wheel here. That is reusing some of the work. Great. Also coming up, there is the background module for this assignment that gives this list of 9 things that should be included with some additional detail on what goes in there. And that is very helpful to include because that is telling you, oh, here are some of the things that you should talk about, that you'll be expected to do, and even though they're not in the main assignment instructions, it in fact gives you that extra detail to know what's going in there and to help make sure you do all the things that are expected here. All right, so the next thing that we're going to do here is we're going to talk about how to go from these different sets of instructions to outlining the paper, because we want to make sure that you get full credit, and one of the requirements for getting full credit is to make sure you discuss all the things that you do. So with that in mind, I'm going to go ahead and change my sharing here. We're going to go from sharing the uh, PowerPoint slides to sharing a copy of the course paper template. And you should now see I've got a blank copy of the APA course paper template here. And when you get this, you'll see that it has some comments here. All right, not a problem. Once you've read them once, you don't need to read them again. So we'll just go to Review on the ribbon and select Delete all comments and document. There, we've cleaned that up. All right, the next thing we're going to do is going to put in the title here. And in this case, we're just going to start out with the most basic of titles. We're going to give the name of the assignment. And you can certainly go fancier, but we're going to start with what we need, which is to say, to identify what we're doing. And so what are we doing? Well, we're writing a political analysis and strategies paper. So I'm just going to paste in the title here. And okay, political analysis and strategies paper. Can make it more specific later, but what we need, put in your name, your affiliation, which is with the program, the course, the instructor. You can do all that on your own. We also want to have the title here at the top of the first page of the body, because that's just one of the things you're required to do in APA style. All right, not a problem. Got that in there. And at this point, we're going to start looking at the body of the paper. All right, so what are we going to put in here? Well, a easy way to start is to just go ahead and go to the assignment instructions and copy and paste them in. So let's start with that. We have a list of things that we're supposed to be describing that we'll add here. And you can see that we're starting out in the same style. That's good. We're also going to go ahead and grab the rest of that. And so we have a list here. All right, now you can start just crossing off this because we have that list that we're supposed to do. Okay, not a problem. And we're also going to go ahead and add in the other items there from the additional list. So we've got identify the issue. All right, so that tells us we have give the context, evaluate the effectiveness. All right, that's good. Political feasibility. So this is coming again from that module here. We're supposed to identify the stakeholders. All right, so that's going to go in here. And we need the economics and resources. That's definitely going to go in this one. And okay, the equity of the policy. So this is where the item covered in the module that's called values assessment goes. And the networks and coalitions, that could go in a couple places, but I'm going to go ahead and put that here under social responsibility. All right, power, that can go many places, but we'll put it here for now. And goals and proposed solutions, that's definitely going to be here. So you can see that we've gone through this and we found that we have a list of what to write about here. And looking at our main points, 1, 2, 3, 4, 5, 6, 6 main sections, all right, and those correspond to things in the rubric. From just the points, we can see that this is going to be around 1 paragraph. And from the number of points in the rubric, 2 points each for each of these other things, it's probably going to be 2 to 3 paragraphs. For this one, for this one, this one, this one, and this one. Throw in a conclusion, always good to have that, which is probably going to be 1 paragraph. And we have actually ended up with more or less 5 to 7 pages here from this. There's room for some of these to go longer, but if it's only 2 paragraphs, that's not a problem. And so now you can go and put in, oh, hold on, we need to describe our framework. All right, that framework is going to go in here because that's going to affect how we view the issue. You know, if you're using, say, the hierarchy of needs, well, of course, we need to start with basic things. You know, are they bleeding out and dying? All right, that's taken care of. Now we can worry about some other things. So how this proceeds will depend on that framework, but we already have a basic list of things to discuss. So when you write your discussion post, you can then return to this and say, oh, well, I identified this thing. Let me go ahead and put that into the outline. And there we have it. That is our discussion for here. We are wrapping this up in a nice, concise 20 minutes. So let's just review the things that we've talked about before we say goodbye. So we have started from looking at the genre of policy analysis papers. These are designed to evaluate the specific policies and discuss how those might be changed and the pros and cons. It's usually going to be analyzing government policies, and healthcare is hard to separate from the government in the United States. We need to know who our stakeholders are, who you're writing to, and we want to make sure that this is something that is complex to merit a 5 to 7 page paper on it. We want to make sure we're giving clear and specific recommendations, keeping in mind our audience is usually not an academic one, and that we want to anchor this as much as possible with data, and that we're not giving just general hypotheses, but we are connecting what we're recommending to what is known. There, you can view some sample policy papers, including opposing ones from the American College of Physicians and the American Association of Nurse Practitioners. And with this assignment, we went through and discovered that there are 3 related elements. There is the discussion post where you select the framework. There is a module that identifies some extra levels of detail to include. And there's more when you look at the page than just I have on this slide. And also from the assignment itself, we see from looking at the rubric that the summary is our opening part, but that we'll be spending most of the paper on these other things on the effectiveness of the policy change, talking about the efficiencies, how this improves or at least does not diminish the equity. We don't want to make things less fair than they were. That's not ethically good. The implications, what are the trade-offs for doing this in economic terms or in terms of patient privacy and things like that? How is this going to be socially responsible? And of course, are we meeting the basic parameters for length? Is it formatted correctly for APA style, and so on and so forth? So that's what we have today. Please feel free to follow up via email if you have any questions. And with that, let us say thank you for joining us, and you know how to reach us if you need any help.